It's a surprising but common risk of weight loss surgery. Patients who have gastric bypass can transfer an addiction from food to drugs or alcohol. That's what happened in the case of Jessica Pfau. We took you on Jessica's journey earlier this month from gastric bypass surgery to opioid and alcohol addiction, followed by multiple DWI charges, failed attempts at treatment, and surviving an overdose. Our KELOLAND News investigation continues with what kind of help she will get now that she is behind bars. When we last saw Jessica Pfau, she was reporting to prison to serve out her sentence after violating her parole by using heroin laced with fentanyl and overdosing. Jessica was sentenced to 2 years in prison for possession, ingestion, and her 6th DUI because she had been behind the wheel of a car when she overdosed and was saved with Narcan. Will you get treatment in prison?
There is no treatment in prison, not in the women's prison. They're really short on counselors.
According to the South Dakota Department of Social Services, which provides treatment programs in prison, only 3 of the 5 addiction counselor positions in the women's prison are filled. Governor Kristi Noem told us 80% of women in prison are dealing with addiction.
I don't think we do enough in our prison system. If people are sitting there in prison and not getting any help, I think we're doing them a disservice.
According to a national study, only 10% of inmates in state prisons get clinical drug treatment while they are behind bars. Medically assisted treatment for opioid use disorder has been found to be most effective, but Pfau won't be prescribed any medications to treat her addiction behind bars. Pfau provided KELOLAND Investigates with her assessment by the Department of Social Services made December 10th. Pfau has not been recommended for an intensive 14-week 42-session substance use treatment program. Instead, she will get substance use aftercare treatment, a once-a-week group meeting for 8 weeks. Pfau told us she understands there needs to be consequences after she continually broke the law.
I know there's times where we can't be in society as addicts because we're going to harm ourselves or other people.
Then where do we put you?
I don't know. And that's something that I think is a really big issue because prison's not going to help an addict.
The Department of Social Services says all of its recommendations follow clinical guidelines for treatment, and inmates are also able to attend self-help groups like AA and individual counseling. However, DSS won't specifically talk about Pfau's treatment, citing confidentiality. Governor Noem told us she is calling on the Department of Corrections to come up with a more comprehensive treatment plan and follow-up care once an inmate is released. Jessica's journey is just one of our 2019 KELOLAND News investigations. You can see the top investigative stories of the year tonight on KELOLAND News at 10.